everyone. Welcome to the Control Yourself podcast. I never have introductions, so I don't know why I started that introduction. I'm here with Dr. Shawn Thistle, who is, how do I explain Dr. Shawn Thistle? He's a personal friend of mine, but you know what, Dr. Thistle, why don't you give me a potted version of why you are important, I guess I want.
Oh, wow. That's one way to put it. As you said, we've been friends for a long time. We went to school together at CMCC, which feels like a long time ago now. But since then, I was in practice for 14 years-ish, working on a variety of different clients and, ranging from pro athletes down to just regular people like everybody else. And in the meantime, I was building a company that deals with knowledge transfer. So just like you, when we were in school, we were kind of nerdy and like to read stuff and make people try and understand it. And
funny enough, I don't remember it that way. I remember me being cool as shit and riding in on a horse and stuff.
Yeah, like it was a unicorn, wasn't it?
Yeah, we clearly remember different things.
Yeah.
No joke. To cut what you're saying, I was going to say that in many classes, between you, me, and the instructor, that was the only discussion going on for the extent of whole courses at some points.
That sounds familiar. Yeah. But anyway, as I was in practice, I always realized that I like treating patients and it's fun and everything, but I enjoy speaking and I like the knowledge transfer bit and seem to have a knack for helping people understand research. So I started a company where we did a subscription service where we review a paper every week and help people apply it into practice. And that branched out over time, kind of like your company, into different things. So now we do online courses and I do seminars mainly for chiropractors, where we spend a day and we talk about research and how it informs practice on things like spinal pain or headaches or concussion or disc problems and so on. So the company is called RRS Education, and we have customers all over the world, and I do it full time now. So I still see some patients. They either come to my house or I go and see them mostly near where I used to practice. I usually go in once or twice a month, put my table in the truck and go and see some people. And some of my athletes, when they're in town, I see them too, but that's the guys I worked on are all kind of retired now. So they're kind of buggering off into other places. So, yeah. So
well, that's good. We'll add on. Oh, you know what? I should probably turn that volume thing off. Yeah. And as well, you can still hear me?
Yes. What?
I can't hear you now. Hold on.
Oh,
can you hear me now?
Yes.
See, now I can hear you. This is the first podcast that we've done post, pigs starting to fly and fat ladies starting to eat them out of the sky, I suppose. So post COVID-19. So this is the first time we've done a podcast this way. So I'm going to be fucking around with my controls a whole hell of a lot. And as we were discussing before, we may or may not have pants on, which is new for me.
I mean,
you know what I mean?
I put on my good sweatsuit for you today. It's my Wednesday tracksuit, so you're welcome.
Yes, sponsored by Nike, I see.
Yeah, I just said to my wife this morning, I don't think I've worn leather shoes or a watch in about 6 weeks.
I didn't even put socks on, man. I'm just barefoot like that.
Oh, me too. Yeah. And again, the pants will remain. That's an unknown for both of us right now, and that's how Zoom goes, man.
Now I'm going to add to your bio, but I do want to point out you just won an award in our profession. So again, for those of you who don't know, Shawn and I went to chiropractic school together at Canadian Memorial Chiropractic College in Toronto. And then you just won is it for OCA? Is that the?
Yeah, I won the OCA Chiropractor of the Year. So that was really.
Holy.
Thank you.
My classmates. One of my classmates.
Yeah. How about that?
That's excellent. So, you know what? We can talk about a billion things. I think if we want to narrow this down, considering that you branched off and became the research guy or a research guy. So for those of you who don't know, when people ask, how do you stay up to date with all the literature? It's a strange question because nobody stays up to date with all the literature. That's not, and even you run what was called a research review service. You're consuming research, you're giving the breakdown of what people need to know.
Yeah.
And even in that regard, you're not really following all the research. So
no, I don't think anybody can.
Yeah, absolutely
You know,
not.
you know, and I cater to a very clinical kind of chiropractic audience, but that means you still have to pay attention to multiple areas of research to try and make some overall sense of it. And that's, you and I talk about that quite a bit.
That's what I wanted to get into, because I personally, I feel like there's a perpetual misunderstanding as to what research is and what research should be doing for you. I guess that's a bad way to put it. What you should expect from research, where there's people who look at research as they're trying to find an answer to a question. And then it just becomes a matter of who read that paper last, right? It's like everyone is only as smart as the last 4 papers they've read. Those, you know, when people are research, this said this, this said that, and opinions are constantly changing, even though the amount of research is not sufficient to change people's mentality. So there's just like, speak to that, because you've been dealing with your whole career, the misunderstanding of research.
So it's this thing, right? Like, no, we're at a point now in most of the areas that you deal with and that I deal with, where one paper probably isn't going to shift the landscape too much. But all research kind of is additive in its knowledge. And the problem with how people consume it typically is, you know, they consume it in little bits. And I try and do digestible bits, but as you know, I also do it in a bit of a longer format. Like, I think there's a happy medium between an infographic with 2 bullet points about a paper and then reading the whole paper. And I think that's where I try to live. Like, I feel like as professionals, we have to give research a bit of respect and spend a bit of time to get to understand what it means, how it works, how it's being done. But you know, the way an individual clinician or practitioner consumes research is really variable. Like, it ranges from people not consuming it at all, or they only look at things that confirm their own existing biases. And I think that's a huge problem in most professions, and that is littered throughout chiropractic. Like, people don't want to hear about things unless it makes them feel nice about how they already think or how they already do things. And so I've called that like fair weather research consumption. Like, they want to hear about it as long as it makes them feel happy inside. And I'm not sure that's what research is for. Research is to inform thought and it's to inform action, but it can't be the only thing you lean on. And I've always, you know, people might misunderstand me as someone who just leans 100% on evidence, but I think when I was younger and when I started this company, I leaned a little bit that way. But I think part of maturing as a clinician and as a person, and then as you see how research is evolving on numerous fronts, in combination with what we've sort of known and investigated for years, you have to take a broad view of things and realize that there's still a very variable human being in front of you, whether you're doing exercise with them or whether you're going to put your hands on them and do something, or whether you're even going to talk to them. So I think research is part of the matrix that informs all clinical interactions. We just, you know, my task in my career is to make people at least acknowledge that the research part is there. And that's not easy sometimes. Like, research, like you said, is overwhelming to some degree. Like, I can't keep up on everything. I look at probably, I think it's about 85 or 90 journals a month and just see what's there. And then I pull it and I have a folder of like 1,000 papers that I go through once a year and make sure I'm not missing anything important, or I place it in a folder to put in one of my slide decks or whatever, or decide what we're going to review. And I do that with my writers and stuff too. But the possibility is there that I miss things sometimes. But if I'm missing things, holy shit, like, people are missing everything. So I think, you know, and if you back up even from that, sorry, this is a long answer, but if you back up even from that idea of how do we get...
I have nowhere to go.
Yeah, I know. I can't go outside because it's raining and it's awful. Yeah. But I think we have to take a hard look at how our whole society interacts with science, because partly I think there's a lot of research coming out now in every field, a lot of which isn't great. Like, I think 30 years ago, getting a PhD and being an academic wasn't quite as sexy an option as it is now. So the result of that is there's a lot of research being published, but I would argue a lot of it is not terribly useful. And that's no knock against individual researchers, but the job of evaluating, and you would know this too, figuring out the good stuff from the not so good stuff is becoming really hard, and partly because it's a volume issue and partly because of the publishing standards and landscape, let's say, like predatory journals, online journals. Just because something says it's peer reviewed doesn't necessarily mean it's peer reviewed anymore, and peer review is subject to its own problems as well. So I've become a little more open to talking about just the limitations of research as a system and how we interact with it as individuals, as professions, and as a society. Like, you and I are both going to be in the healthcare system at some point as patients. And so you want them to use what our tax dollars pay for in terms of, you know, what are the results of good, credible science say? And if it doesn't trickle down to actual action in the healthcare system, then what's the point? You know?
There's a lot to unpack there. So
yeah.
No,
I'm gonna have the rest of my coffee. So here.
There's a lot of points there, but some of the ones that I pull out right away is some of the things that I like to lecture to at the seminars. And then another thing I wanted to bring up, just so I don't forget, is how it's weird how people look at you in one way with regards to how you interact with research, and other people who've never met me, they think I interact with research on the complete opposite scale, which is so far from the truth. So let's get to that. But the first point I was gonna speak to is, I always tell the students who attend those seminars is that the scientific revolution is, you know, I would say 500 to 600 years old. I mean, if you give or take, you know, a few years in there. But in order to really understand the scope of knowledge that has been accumulated over 500 to 600 years on a particular topic, it almost warrants that you take a complete, you call it a 30,000 feet, a bird's eye view. We're getting at. Because without that bird's eye view, especially now, and you brought up another point about social media, especially now that we're all being forced into our little comfortable spaces where I only see posts that I like. Right? All of that together, like the idea that research, like there's a lot of people that you probably know as well, that if a paper is more than 5 years old or 10 years old, it's like they have a number in their brain. Whatever information could have been garnered from that research is no longer relevant because it's not new enough. Right? You have people all the way on that scale, and then you spoke to the idea that we're kind of in our little bubbles, but that's not a new thing. Even when we were in school, like how many people ventured outside of, you know, Journal of Manipulative, JMPT or Spine? How many people went in? I mean, we did all the time. We kept yelling that you have to. Like, we were in plastic surgery journals. You know, we were looking at evolutionary biology. But you're right. You're kind of pigeonholed into a particular area of research, and then you're led to believe that there's no other outside factors that should influence what you do other than the soundboard of your profession.
And that's, you know, I think social media is partly guilty for this. Like you said, it's the algorithms built into those systems, and that's like a conspiracy talk we can have some other time, but those platforms are unfortunately really starting to shape how people think. And I don't know if that was their initial goal, but I think that's their current result. And that boils over into politics and a whole bunch of other things. Like, we have to be careful with that, and science is not immune to that problem, right? So
well, I would say that science is not only not immune to that problem, but science is in the forefront of that problem, because it's a reliance on experts, which is another area that is slowly dwindling. So you have this.
It's already evaporated. If not,
I'm trying to be nice. You know, it's like you can't. There is no such thing as authority. There is no such thing as, you know, rigor. There is no such thing as, you know, this. To be honest, like, we went through, and for my system, you have a system too. Like, we all have a system. For my system is one that I teach other people, but I've been analyzing my system, which is my way to do things, ever since I can remembering that this is the system I want to use. Like, at every point along the way, it's like, is this making sense? Is it logical? Is it, and this is with an influx of people who, because of the social media age, they see one sentence of something you said and they automatically jump on it and start, bashing what you're saying without any context, without any long-term discussion as to what you're doing. So getting back to what I was saying before, it's like, you've been looked at, because you're a research guy, whatever that means. Mm-hmm. You've been looked at this guy who is a staunch researcher. I'm assuming that people don't even want to talk to you about research because they can't quote RCTs and the years and dates in the back of their head.
Yeah. I get some of that.
Okay, and I know that to be completely false, because from my interactions with you all these years, what I realize is that you're doing with science what was originally intended in science. It's not like this is a new concept. If you look at the people the philosophers of science, they'll say, they've been saying the whole time, you can't rely on research for evidence. Research and evidence is not the same thing, technically. Research is the attempt to build knowledge, but evidence is the pooling of knowledge.
Yeah, I would say that's true. And it's, it gets into the discussion of the pillars of evidence-based medicine. And, in the chiropractic profession specifically, there are some that rely solely on their clinical experience, which if I would say respectfully is often dogmatized a little bit based on their education, depending on what school they went to or how long ago they went to school, for example. Mm-hmm. Patient preferences are important, and I think everyone needs to listen to that part of the triad a little bit more. Mm-hmm. And evidence is one part, and I think people naturally have a bias in terms of which portion of that model they want to pay more attention to. The challenge is really sewing them all together into something that makes sense in clinic or in the gym or wherever. And that's where the challenge of it is. And I don't think really anyone's done it perfectly yet. And it's really, it's hard to get people to get a grasp on that in a way that's meaningful for them, because, in our profession and in the training and strength and conditioning world too, a lot of people just do stuff because that's what they've always done. And that's what they were taught. And, the human learning is an evolutionary process that even exists within someone's lifetime. But it seems like we put artificial starts and stops on that. Like I'm in chiropractic college now, and I graduated 10 years ago, and I'm like, okay, cool. So that you and I know a lot of the stuff we were taught there is kind of bullshit. And I'm not saying that in a bad way. I just mean, like, science has evolved, and what I teach at that college, and my lectures are different this year than they were 3 years ago, never mind 10, 12 years ago. And so knowledge evolves, but getting people that's an uncomfortable thing for people, because people like to think they know stuff and that it's concrete and that it's unchanging, but I don't think that's the way it is. And having that open mind is a challenge for some people, for sure.
And then on the flip side, so we're talking about the research in general. So I also seem to think, and maybe again, this is a factor of the social media influence, that some people actually use research, they weaponize research.
Oh yeah.
Is that okay? So this is when I say that term, you understand exactly what I'm talking about. There's like Twitter scientists.
Yeah.
Who at any given moment, they're gonna jump at anything that you say. Like that there's nothing that I can say at this point where someone's not gonna jump and say, well, they're gonna try to call bullshit using a paper. Mm-hmm. And it's as if they're saying that, it's as if they think I didn't read the paper. Like, let's go back to what we were talking about before. You have this thing where everyone's like, oh man, all you do is read research, and you never come out of your hole, and you don't use the research to make thought processes, which 100% not true. Yeah. But then you have people who have never met me. Like I've never taught you, I've never interacted with you, but it's the exact opposite thing. It's like they think that I'm somehow just stealing people's ideas and putting it together in some guru type thing where I go and tell people to move and that's exactly not true either. And the problem is that there's no way to explain that other than to have someone come and listen to me speak. Yeah. Which sounds shitty, because then the answer is, well, no, what you're saying, like, I'll give you an example. So pails and rails. So by now people know what pails and rails are. Mm-hmm. But every time you put up something on Pails and Rails, there's going to be some fucking person on the internet who's like, what's the difference between that and PNF? It's like, okay. So
it could be an honest question.
Stupid I would have to be, okay? So what you're assuming is, number one, I've never read anything on proprioceptive neuromuscular facilitation.
Yeah.
Okay. Dude, I've read everything on you know this.
Yeah.
You would have to think that I didn't read on stretching physiology and what stretching is and what stretching does and the idea of reciprocal inhibition. Like, people think that I didn't read Sherrington's work on reciprocal inhibition. And by the way, Sherrington, as a researcher in general, I advise everyone to look into his history, because he's a researcher who should be admired way more than he is. But getting back to me never reading any literature, the assumption is that, like, I'm just stealing something and clearly, if you do any type of stretch with any type of isometric training and you put a video to it, it's going to look like anyone else doing the exact same thing. But it gets back to the point. The what you're doing has nothing to do with what you're doing right now. It's the thought process that went into why you're doing it.
Yeah.
You know, I've never said I've reinvented the wheel. Sure, I've taken all, research in human physiology and I've tried to compile it into a workable model that is backed by evidence where possible. And where not possible, at least I'm filling it in with basic physiology or neurological evidence, because that's what you do. You have to fill in gaps where gaps are.
The difference between a guru and a scholar is substance.
Absolutely.
I think. And, for guru is a funny word because, it's used in a derogatory manner to some degree, but I think a lot of that comes from people's own insecurity. Like, well, I didn't figure this out, so you're just a guru trying to steal my money or whatever. And I know you get that a fair amount, but what they don't see, like, from people, as someone who's known you for a long time, 20 years now, this is not something you just came up with one morning, right?
Yeah. Like, I have an idea. I sit there literally like this, and I just do this, and I laugh like a villain. I can't do it with a fucking
and as you know, and I get this. I'm very aware of this. Like, I do a lot of speaking at conferences and in my own seminars, just like you do. I learn something every time I speak, and every time you amalgamate information. And if you want to call that stealing, then fine, I guess. I don't know, like, information is information, research is research. How an individual puts it together is kind of up to them. And if that makes you insecure enough to use guru in a derogatory sense, then that's on the individual, not on you. But I learn something every time I speak. And part of what I enjoy about that is figuring out how a room full of 75, 100 of my colleagues are interacting with what I'm saying, and if they're understanding it, and if they are intellectually challenged a little bit. And there aren't many.
Brilliant.
Well, yeah, like, part of your job is to stimulate the audience you're speaking to, and speaking is a whole thing. Like, that's a challenge in the research world now too. They're trying in our profession to groom younger researchers to also be better speakers, because if you can't get your point across at a conference or on something like this, then you lose part of your utility as a knowledge generator. And I think that's, not everyone's good at speaking, and you know that, but it's something that we have to develop in our younger researchers. It's part of your job to be able to speak. And if you're not good at it, that's okay too, but let's realize that about you early, and then let someone else talk about your research, or partner with someone who is a better speaker. And, the teaching in and of itself is part of your process of putting everything together and coming up with new things. And it's also part of mine. Like, every time you talk about a body of knowledge for a full day, the speaker is going to learn hopefully as much as the people sitting in the room do. That's the way I look at it anyway.
100%. And the other thing is that there has to be some, the other thing is that when someone does put themselves out there in front of a room of people to speak, I don't automatically give them credit for what they're saying. I give them credit for saying it, though. Like, it's not people might think that you just go in there and I just spew my stuff, or you go in there and you spew your stuff, but you're spewing your stuff to, you know, a room full of brains who have accumulated their own knowledge, right? Mm-hmm. And not only have they accumulated their own knowledge, but speaking of what we spoke about before, it's impossible to keep up with all the research. You hope that you're up to date with the research that directly affects what you do, for sure. Mm-hmm. And then you have to cast this huge net, which makes it difficult to only be up to. So there's always someone in the audience who just read a paper yesterday, right? They just read a paper yesterday, and in that paper, something disagrees with what you said, right? And there's people, and this is what I learned from seminars, there's people, you can almost see them right away. They're just waiting to put their hand up, right? There's different people in a seminar. There's some people at a seminar taking selfies. They're the selfie seminar goer. Right?
I think you get that more than I do.
Yeah. Then there's the quiet consumer who you can be taking a lot of notes. You know what I mean? You're taking a lot of notes. Then there's people who give you too much status. Mm-hmm. You know what I'm saying? Like,
well, they just believe anything you say, when that's not my intent and it's not yours either.
Absolutely. And I go as far as saying that at the beginning. And then there's the people who are ready to pull the trigger on you. They're just, their hand is like, and you can see they're looking at your things and they're trying to pick out one thing that they can just, that's wrong.
Yeah.
You know, that's wrong. And it's those people, and it's the people on Twitter who are, you know, we talked about this yesterday, the other day, we were talking about soft tissue, right? And how soft tissue is a topic where if you're making hard and fast conclusions about it, I'm going to say it, I don't think you really understand what research is trying to do for you.
Yeah, I agree with that.
But there's a million people that as soon as you say, you know, I did soft tissue on my client in any way, they're going to run at you and just, they're on Twitter. They're ready to press enter. These are people who follow us, but funny enough, I don't follow them. And I never, you know what I mean? Like, but it's
you don't follow anybody.
Well, like, listen, I follow you. Like, you know what I mean? Thanks. Like, if you give me a logical, I always tell people, give me a logical scientific reasoning as to what you think, and then we can disagree, right? You can't pull shit from the air, though. You can't just make shit up. Give me some, like, I base my thought process on this, and then I look at your thought process, and I say to myself, are you contradicting any of the laws of human physiology? Yeah. If you're contradicting the laws of human physiology, I immediately put you in a different, you know what I mean? Like, I'll listen, but I'm not really gonna pay attention. Because if you kick me out of human physiology, we're done, right?
Yeah. Well, I think, you know, this idea of the trigger puller at a seminar comes directly from a social media world where it's like this gotcha culture of everyone's trying to take someone who has a bit of status and that people listen to and try and knock them down. It's the way people try and make themselves feel good. And I'm not necessarily against that idea as long as you do it from an informed, rational, respectful way. And I put at the beginning of all of my seminars, like, some disclaimers. And it's kind of a joke. Like, I don't want to start with disclaimers, but what we talk about today is as current as I can possibly make it. And it may change. And, you know, some of the things we talk about today could change next month. And the final one that I put on is to our point about, you know, amalgamating all knowledge and research is it just says, I may have missed something. And, you know,
you imagine that one line. Yeah.
Well, it's true. What I always put as a footnote to that is I don't think I've missed anything that would radically change what we're going to talk about today. Mm-hmm. But, you know, new things are coming out all the time. And I don't think our worlds differ in a sense that our consumers don't consume as much knowledge as we do. And that's not that's just part of our job is to do this for people. But I also expect people to come into my events with an open mind, but with some questions, and not necessarily, like you said, to overtly just purely believe everything I say because I'm Shawn Thistle. That doesn't make any sense to me. Mm-hmm. I don't go into any speech or talk like that. Like, I'm open to listening to anyone, but you have to have your wits about you in that sense. And the trigger pullers are, I don't know. I don't know what to think about them. What do you think? Like everyone in a way, everyone in chiropractic, let's say, because that's the world I'm familiar with. Chiropractors are on stage all day long with their patients, and they are the teacher, right? But
That's their job.
That's their job.
And then anything else.
Yeah, and then they come to an event, and some of them, I'm not sure I would call it trigger pulling. I call it like they're storytellers. They want to come up to me on a break and tell me a story about their practice to make them feel validated that they understand what I'm talking about or whatever. And I don't think that's nefarious. That's just because they're used to being the storyteller, and it's hard for them to sit for a whole day and not have their input. And that's fine. Sometimes I just have to go for a pee on a coffee break in an 8-hour seminar, but you get this, people are coming up to you and I'm like, I just have to pee. Can I go for it?
This is not a knock on you. I've had some people follow me to the washroom too.
Yeah, I've had that too. The urinal conversation,
which is, I'm fine with it. It's perfectly fine. But
yeah, I actually consider it all a compliment. I find it humbling that someone wants to spend their money to spend a day listening to me talk. I think that's pretty cool.
I think it's miraculous. I mean, I'm amazed every single time. And you know what? Speaking to what you were saying, I do the exact same disclaimer. I don't do it as a disclaimer. I apologize for what I know might bother people at the beginning, which is kind of the same thing. And one of my apologies is, all right, guys, so I'm drawing from the same knowledge pool that you guys are. Right? So it's not like when someone's like, there's nothing new under the sun, they yell it at me like they're insulting me. But I tell people that at the very beginning. I say to it, like, if anything I'm saying sounds out of the ordinary, then it's probably because I'm bullshitting you, right? Like when someone comes out of a seminar and they're like, oh my God, I have never heard of any of that information.
Yeah.
99.999 times out of 10, that person was full of shit, because it's not like you have access to information I don't have access to, right? So at the very beginning, I go, this is an interpretation of the literature, which is all you can teach, right? Like, see, this is the thing. No matter what you're doing, no matter how research staunch you think you are, you're only giving the interpretation of the research as it's passed through your consciousness. Like, there's no way to not add interpretation to research, especially in our field, let's say manual therapy, physical training, because we're not doing drug studies. It's not like we can say A or B, fucker, like which one is it? It's not like that. So I always say, this is my interpretation. If your interpretation differs than my interpretation, it's possible that we're both right from an evidence standpoint, but you got to give me some kind of scientific rationale as to why you think your interpretation is better than mine. And then we have a discussion that we can disagree or agree on.
Yeah.
You know what I mean? But nobody out there is right, because that's not what science is.
Well, one of the other things I add at the beginning of all my seminars is that, in a room, I'll have everything from a new grad to someone who's been in practice for 60 years. And those are two different docs in a lot of ways that come into a topic with different sets and types of biases. And it's really, people it makes them feel funny when you tell them that everyone has their own set of biases that they come into anything with, myself included. But I'm going to ask you today to allow me to push on those a little bit and figure out where they are, and we can talk about it. And it's, if you get people in that mindset before you talk to them, it can get that defensiveness down a little bit. And I used to sort of go into these, I guess I can admit this, I used to be upset with my colleagues who were pretty far behind in the literature. And I'm like, well, how can this happen to you? Like, you graduated 25 years ago and you basically haven't read shit since then. How could you do this? But they've got 3 kids. They've had a practice. Their practice is pretty good. They're probably good with their patients. And I understand how it can happen, because keeping up on stuff is hard and it's a lot of work. And I guess in a way that's why they're at my event, because they expect me to sort of give it to them in that sense. And I think that's, I've really softened on that. And now I approach every seminar, like if I see someone struggling with some concepts or some newer things, my job is to pull them along with the rest of us instead of think poorly or, think you know, in a bad way about how they've done things.
How are you not up to date?
Well, yeah, I mean, that's just, and most people feel guilty about not being as up to date as they should. They had, you know, and I get a certain faction of our profession at my seminars. I'm preaching to the choir to some degree, but even if I ask a group of people at my seminar, like, how many of you read abstracts, like more than one abstract a week? It's less than half the room. And then I say, how many of you read a whole paper a month? Goes down again. There's only like one or two people in the room that read full papers. So it's hard to, then we can't possibly expect them to have the same perspective on things that I do, or someone else in my position who's trying to amalgamate all this stuff. So your job then is to help pull them forward and help, you know, give them something to take back to their office on Monday. Because at the end of the day, people come to us to get things to do with their patients. At the end of the day, everyone has to go and see clients or patients on Monday morning and have something to do that makes sense to them and makes sense scientifically and is hopefully going to help people. And that's what that's what you and I are for. It's not about,
that's what we're trying to do. But we were speaking before, there's a subset of the population where if you come out of a talk, you're going to come out saying, oh, so nothing works. We can't do anything. Everything is horrible. The world is just, and I just don't understand. Like, you were asking me, can I explain that? I can't, because you know what people I'm talking about, or who I'm talking about, and those people have to also see patients, right? So again, you can always sit on the ready on Twitter and say, that's not right, that's not right, that's not right, that's not right. It's easy to say that's not right. Like, with all the literature you consume, with all the literature I consume, it's not a hard task to sit back and go, no, you didn't read this. No, you didn't read that. No, because like what you said, not everyone their job is to consume, right? It's easy to nitpick at what people don't know. What I find fascinating is how to take what we do know and, like you say, compile it in a story such that someone who doesn't know understands the story in a way that they can then apply evidence-based concepts just because they're running it through the system on which the system was based on evidence-based concepts.
Right.
So,
right.
I mean, that's how I look at helping my client, right? Like, you're in the business of informing of what's out there, and hopefully that information helps them Monday. I'm in the business of giving people a thought process, a way to just attack this in such a way that you can kind of narrow down what it is you need to do. Because there's another seminar goer that we never talked about, which is the endless consumer.
Yeah.
And that's just as dangerous as someone who took one seminar and just ran with it. Does that make sense?
I know.
There's
it's a happy medium of consumption is the best that you can. I don't know. It's like that. It's the idea that the older I get and the more I read, you kind of come to the realization that we don't really know as much as we think we know, but it's okay if you approach it in the right way. But it's kind of analysis paralysis if you go too far into it. If you go to every technique or everything available, you're going to end up confused, if that makes sense.
I run into it all the time, because you know that I'm trying to teach things based on the laws, as close to laws as you can get with research. I try to base everything on those laws of physiology, right? Like, so at any time, if somebody goes, I disagree, you go, okay, I go, okay. Am I breaking the laws of human physiology? Like, that to me is the lowest degree, right? Like,
that's your bar.
That's my bar, right? But people will, I'll say, okay, let's look at this person. And I go, move your shoulder around. Like, just, do things with your shoulder to show me how much of a shoulder you have. You know what I mean? Let's just say that. So someone moves the shoulder around, and in the room, there's like 17 different 1,000 different ways to go and different ways to analyze it. This muscle initiated the movement, and I'm like, you saw that with your eyes? So there's a subset of research that you don't know. Like, if you think that you saw someone move and you saw a bump swell faster than another bump, and that allows you to say that you see the motor pattern occurring.
Yeah, it's
like, okay, so I'm not you. There's there's like, if the pie is everything you need to know, there's like just shy of half of it that you have to review, because that can't be the case, right? Like,
yeah.
you know that, and I know that. Like, I look at that person and I go, okay, do they have a shoulder? Like, let's stop everything, because there's one person says that. So another person goes, oh, when they move their shoulder, their left knee rotated. And then they give us a kinetic chain, you know.
Sure.
I can go through the human body of the anatomy. I can get you from here to your toe.
Sure.
But that doesn't mean anything. It just means that I can spew a lot of anatomy, right? Like,
well, it means something theoretical, but it may not mean anything to the person in front of you. That's the challenge with,
that's what I'm saying.
To me, one of the things that you and your team and your systems have figured out better than anybody is all of it has to be individual.
Mm-hmm.
It has to be. Even when you look, that's why movement screening doesn't predict shit. Mm-hmm. But it doesn't mean we shouldn't do it. It just means that if you take it on a population level, a 30,000 foot level, it doesn't really tell us much. But if you drill down to one person in front of you, watching them do a step over lunge or whatever can give you some useful information. Mm-hmm. As in the context of everything else. I think that's what people miss. Everyone's looking for, we talked about this the other day, like everyone's looking for the algorithm that goes from A to B to C to the answer. But there's context at every step there. And I think that's what people miss when they're looking for simplicity and those things. Like doing what you do at the end of the day is a personal thing that you have to develop over time based on solid concepts, but you have to apply everything individually. And that's it steps back to one of the fundamental weaknesses of research these days is humans are not homogenous. Mm-hmm. And you mentioned drug trials. Like I admit, and I've written about before, how manual therapy trials are at a disadvantage to drug trials. But what I haven't talked about, and what I think is also relevant and salient, is that drug trials aren't perfect either. You can standardize a dose of a drug, mm-hmm. but do they ever do a dose based on size? You and I are different sizes, right?
Have you read Scale by Jeffrey West?
No.
Okay, it's physicist. You're gonna love this book because it's exactly it's exactly what he talks about with regards to scaling things. It's very difficult to scale things up and scale things down because it breaks apart at some point.
Sure, but imagine the drug trial that did a dose based on body weight or some other physiological measure or metric that they came up with. They would be laughed at scientifically, but to me that makes more sense. I probably need more Advil to have an effect than my wife does. Yes?
Just because
I'm like double the size of her. So
you need more shots to have a good time. It's just physiology.
Yeah, like,
you know what I mean?
But to this idea that drug research should be our gold standard, I'm not sure that works either, because they never do that. I've only seen a couple of drug trials ever that have standardized a dose based on body weight. To me, that makes the most sense.
That's pretty scary, actually.
I mean, even body weight's not perfect because the physiology might be different anyway, their metabolism or whatever. Mm-hmm. But to do a 50 milligram dose and give it to a 300-pound guy and then a 120-pound woman and call that the same thing doesn't make any sense to me. It never has. Yeah. But that's the standard of science.
Yeah, there's more stuff. There's more stuff dealing with the stuff you're giving them.
Yeah.
Either there's more stuff or there's less stuff.
I know. We've just boiled it all down to stuff.
It's all boiled down.
Good night, everybody. We'll see you later.
Yeah. There's spaces, and then there's stuff on the spaces. Use stuff to maintain the spaces. Thank you. Good night.
And don't forget the meat. We'll see you later.
Yeah. Oh, let's get to the meat versus nerve. Okay, you want to talk about the meat versus nerve problem?
Are we ready for this?
Oh, okay, no. I'm gonna preface this again. Whoever out there is listening to this, and
hi, Mom.
Yeah, seriously. we read stuff too. Like let's just. So whatever you read, before you assume that we haven't read it, we read it. Okay, so let's just get that out of the way. Like don't come at me with, well, clearly you didn't read this study, because you know what? Yeah, I did. I'm not. Come on now. But now the meat versus the nerves. Okay, so another thing that you get, or I get a lot of, is I deal with the meat wagon only. Okay, so I only care about the meat, the muscles, and I don't care. I don't talk about the nervous system at all.
Everyone's talking about the nervous system. Some people just don't realize it.
Exactly. You
Ridiculous.
know what I mean? So, it's like so Daniel Wolpart, he said that the only reason why human beings have brains is to create complex adaptable movements.
Yes.
And it's very hard not to argue that, because movement's the only way, and he says this as well, that you can manipulate your external environment other than sweating. Those are the only two things we got, right?
Mm-hmm.
So what was my point with that now?
So what I would add
so riled up. Go ahead. Yeah.
I've seen you say that in some of the lectures I've watched,
Mm-hmm.
and I don't disagree with it, but I think it needs a bit of expansion. And I think Sam Harris would add this too. Like,
yep.
Its job is to create motion for all those reasons that you said, but it also somehow layers a consciousness and an awareness on that no one understands completely. Would you agree with that? Like, there's another layer there
okay.
that can change everything.
Yeah.
And we just don't fully understand it yet.
Okay. If we're talking about the idea, okay, man, we got a different thing. If we're talking about the idea of consciousness, I think that if you were to take all the research and amalgamate it, you would have to conclude that the vast majority of researchers in the field see it as some secondary process that emerges, not necessarily because it had to, but just because it's there, right? Mm-hmm. So to say that consciousness was needed as an evolutionary tool, I don't know that that's 100% viable, that we can say that. However,
no, necessary and present are two different things.
Exactly, because in the evolutionary scale, like, just because something evolved, it doesn't mean it did it to get better. Oh my God, does this unlock a can of worms? Human posture. I've said this a billion times. The fact that we're standing on 2 feet is the problem. Like, that's the problem. Like, to say that bipedalism was somehow we were advancing towards something better is to say that leopards have more low back pain than we do. Like, they do not.
So, we know that?
Oh yeah, I'm pretty sure. Well, I'm pretty sure that we can assume, but the reason we're standing is not because it was somehow better for us. So the reason we're standing is so that we free up our arms, so that we can throw projectiles, so we can view our horizon, right? Mm-hmm. So that it's not because we have to fix this low back pain problem. Because if you look at the evolutionary record, degenerative arthritis in the hips and the spine, like, if you look at the fossil record, that like bipedalism kind of brought that, and then civilization skyrocketed.
Yeah.
So the idea when somebody looks at someone's posture and goes, "Oh, that's not right," and then I go, "What? What do you mean that's not right? Like, how can you tell me that his posture is not right?" Mm-hmm. You know a lot about research. Can you define what we know about maintaining static postures?
In terms of what?
In terms of okay, let me not preface the question. Let me just ask you about posture. Is there a perfect posture?
No.
Okay.
Perfect posture for what? For sitting or for whatever?
For sitting. For human sitting.
No. The best posture is an adaptable, changing posture.
Okay, so now everyone listening, it's not Guru Dre, who never reads research apparently. I'm talking to Shawn, the science guy. You're like Bill Nye for manual therapy.
I should have worn my white jacket.
So I didn't make that up, right? I didn't make that up. If you look at the research, it would say that the best posture is a moving posture, because movement is the predictor of health in articulations.
Correct.
Okay, so when someone says that you have anterior head carriage, mm-hmm. and that sets off a cascade of problems that they think they have to fix, can you speak to that?
I think all we know about something like forward head carriage, for example, this is funny because in some people, some individuals, that might be part of their clinical scenario, right? That might be one of the reasons that their neck hurts, for example, or the reason that they get headaches of whatever variety you want to give them. But if you back up again to a population level, the correlation gets weaker and weaker and weaker because humans are more and more and more variable, and there's other shit that happens to them. So there's some data now correlating the amount of sitting that people do with their prevalence of back pain or neck pain or headaches and that sort of stuff. But those conditions are really prevalent anyway. And a lot of people in the developed world just happen to sit anyway. So is it a cause, or is it an effect, or what is it? And so, I don't know, that whole world, and it gets you into the land of ergonomics and how you set up your desk and what's ideal and a lot of it doesn't matter so much because as long as someone moves enough, you can kind of sit however you want, as long as you don't sit like that for too long. To me, that's still the best scientific answer. And if, stand up and move around once in a while, and then we've never even fully quantified accumulative tissue stress from sitting a certain way. There's a bit of evidence there, but it's not fully consistent either. So, and then that's when a trigger puller will say, well, what about this study? But like, back up and look at everything. There's nothing really consistent there. Because if you take a group of 50 people, males, females between the ages of 20 and 60, like an average study, let's say, or 18 to 60, some of those people might be able to tolerate sitting for whatever reason better than some other people. And then that study will come out and say that on average, sitting increases your risk of back pain by X%. But what does that really tell us about anything? Because you have such a variety of human beings there, all of which have different tolerances and backgrounds and physical condition and comorbidities and psychological states and sleep and dehydration and blah, 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 blah. Then what can that really tell us about anything? Mm-hmm. So, this idea that posture in some way is the driver of all things that ail human beings, it's never made any sense to me. And I don't think it stands up to population-wide studies at all. But having said that, it can certainly matter to an individual in your office on Monday for that particular person. That could be one of their main drivers, but you can't just broad brush a statement like that.
This is a fun game because that's exactly what I say. That's to a T everything I've ever said about posture. So let's keep playing this game.
Yeah, so I want to circle back to leopards and back pain for 1 second.
Don't come back to my jokes.
No, because I just want to. You said that leopards don't get back pain.
Yeah.
And my suggestion is, I agree with you. I think.
Yeah,
But maybe leopards don't have the pain science people telling them that they should worry about their back more, and I just wanted to throw that back at you.
Oh my God. Okay.
That's weaponizing science right there.
Okay, listen. You think I didn't read that stuff too? Like, whoever's listening, like, oh my God, come on, man, come on. You know what I'm saying? Like, I just want to get out and talk to everyone and be like, come on, guys. Like, I'm really trying. Like, I've read all of that, and I have never said anything that counters anything that any pain science person has ever said.
It's like we talked about this the other day too. It's like in the last few years, because pain, when we were in school, what were we taught about chronic pain? When I have classmates at my seminars where we're talking about pain, I ask them, like, what at CMCC in 2000 to 2004, what were we taught about chronic pain? All I can remember is that we were taught to look to see if they were faking.
That was the gold standard of practice.
No, it was. Like, if they have pain longer than 3 months, they must be full of shit. Yeah. So neuroplasticity and pain science wasn't really a thing until we got out of school. Mm-hmm. So, but lately, both sides of this argument, the manual therapy side and the pain neuroscience side, it's like you have to pick one. Mm-hmm. And there's no possible way you can combine elements of both into an effective clinical encounter somehow without pissing off the trigger pullers on social media, because they exist a lot. Mm-hmm, mm-hmm. And that just kind of bothers me. I don't think anyone has the final answer, and there's good information on both sides. But that's
I don't even think you have to contradict either. Like, I don't even understand the contradiction. Like, when I was talking about meat before, it's like, okay, so getting back to the Wolper quote, like, if the brain is there to make complex adaptable movements, okay, and let's just say that's true, because you go back to consciousness. But if you stop to think about it, even the words that we construct, those are movements. like words are movement. This, like if we have to go back even further, the word, it means that my vocal cords contracted in such a way to angle such that when you blow air past them, it sounds like this. Word, 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 word. But clearly we don't think in words, right? Because it's like my wife speaks French. Sarah. Sarah. We're all French. And sometimes I stop I'm like, oh, what language are you thinking in right now? And then I stop and I'm like, what a stupid question, because we don't think in language. We think in movement and we think in space. If you read Barbara Tversky's new book, it puts this out beautifully. But we think in movement, we think in space. When I go to pick up my coffee cup, I don't look at it and say, coffee cup, C-U-P, white, grab now, go. No, I just see the coffee cup. I analyze two factors. How much effort is it going to take for me to overcome gravity to get my coffee cup? And how far away is this coffee cup? That's it. So then I put some effort, grab the coffee cup and drink. So I didn't think in words, I thought in movement. So technically, if you go backwards, it all comes back to movement if you go back to it to that extent, right?
Yeah, okay.
Okay. But what is the point of meat? So you have a nervous system. If I just plop the nervous system on a table, it's not going to move, right? Okay. So the purpose of the meat then is to give the nervous system a tool with which to sense its environment. And based on the sensing, it can then produce plans as to how to move within the global environment. So the meat is what the nervous system is using to figure shit out.
Yes, and the meat also, it's the communication is bi-directional there.
Of course it is, because if you go from an evolutionary, from an embryological status, in which we did back in school, it comes from the same embryological process, like, ectoderm, mesoderm, endoderm. Like the nervous system grows meat like a Chia Pet doll. Like that's, you know what I mean? That's what it does. So if the meat is dysfunctional, you can't say just fix what the nervous system's doing. Just like if the nervous system's dysfunctional, it's going to affect the meat.
Yeah.
So there is no such thing as you only focus on the meat and you only focus on the nervous system. It's the same stuff. Like,
yeah, this idea that they're mutually exclusive somehow from a conceptual standpoint, it's kind of like, the split between the idea that, well, I'm a brain-based chiropractor or I'm a mechanical-based chiropractor. Like what the fuck is everyone talking about? I don't understand, except depending on which seminar they've been to and how they've been sort of trained to frame it in their own mind. But again, that's a function of not backing up far enough.
Yes.
Totality of things and say, oh, we're all talking about the same thing, right? We are trying to put some input into the body, be it the meat, the nerves that go back and forth with the meat, the joints that control or help allow the meat to move properly via the nervous system. Like, there isn't anything else there. But you can't go into a treatment with your hands and say, this adjustment is only going to affect the nervous system. What?
You want? Yeah, well, what? Okay, I'll go one further. Fascial stretching. What? Like, I'm not trying to be
nothing else.
Yeah, that's what I'm saying. Like, I'm not saying that a technique doesn't work. People jump on me saying that I'm attacked. I'm not. I just want to talk about concepts.
Yeah.
When you stretch anything in any direction, the idea that you can preferentially stretch some of the meat and not other parts of the meat is beyond irrational. Like, so when I do this, are you saying my skin's not stretching? Like, the nerves aren't stretching? The muscles have nothing to do with this?
Your blood vessels?
Blood vessels don't stretch? Like, and the idea, soft tissue people, they'll take a surface and what are you doing now? I'm doing fascial release. What are you doing now? I'm doing muscle release. What are you doing now? I'm doing cutaneous release. It's like, guys, you have these objects that hit into this barrier, and then when you put forces in, the only language that can be transmitted is force.
Yeah.
Am I wrong on that?
No, I don't think so. I think
besides hormones, I guess, but.
Well, I think all the types of soft tissue input, whether you want to use a tool or your hands or whatever, I don't know if, maybe this makes people mad, but I think patients in and of themselves in their little consciousness have a preference for which type of soft tissue thing is done to them. Some people want something really hard and like get in there and beat the shit out of it, and they want to feel some pain when they do it. And maybe that's what their body responds to. But there are also techniques that the like dermal traction stuff, where you just take the skin, you find which way it doesn't want to move, and then try and help it move that way, whether you stretch it or massage it or roll it or like.
By the way, interlayer release that's part of it.
Yeah, right. Yeah. But it's right intervention at the right person at the right time. And sometimes people's bodies need different interventions in different places. Like, what a concept.
100%.
And like, this is, and I think the adaptability of the thought process is something that you guys have done beautifully. Like, you have to meet the person where they are, figure out what kind of tissue they have, where the problem is to the best of your ability, and feel out which direction or which movement you want to facilitate and get at it. Like, and test and assess, and that's it.
And then once you get at it, I'll add another thing, which I've been spewing for my whole career. If you're not going to follow up that passive force input with some kind of direction as to how they should actively reinforce that input, you just wasted however long you had. Like I have never taken a person and rubbed them and said, I accomplished anything in and of itself. Okay. Other than temporary pain reduction.
Yeah. And there's nothing wrong with that. Just
perfectly. I want to commend you for that too. I'm all good. I'm all good with rubbing. I'm all good with back padding. I'm all good with that. In my brain though, if you want to change a tissue, it's just not the same thing. Like, do you want to rub to make them feel better? That's fine. Do you want to put directional force in such a way that it might help lead them to more loading actively in that direction to influence the cells to restructure themselves over time? Yeah. Well, then there's a lot of research to dictate how to do that best, or to at least have the at least theoretically, how to get that done the quickest. Yeah. Right. And then it's a matter of, okay, so what's the job of a therapist? And that's another question, because I happen to think that pain is a secondary byproduct or reduction. I don't know how to put this, of therapy. In other words, therapy can influence pain. Clearly, touch can influence pain. Sure. Hugs can influence pain. Right. So clearly we can influence pain.
Soft music can influence pain too.
But I don't know that that's our job per se. I feel like it's been made our job, but I feel like if we can steer people's mentality as to, okay, pain is there, but if you teach them how to get in their environment and manipulate their environment and maintain the health of their joints. And there's so many things to work on where when you work on them, pain gets better. But to say that only working on those things is going to cure pain is equally as stupid.
Yeah. Well, the idea that, to back up to like practice patterns in our profession, for example, pain is why most people show up.
100%.
Right? Yeah. I think chiropractors and physios and all other kinds of professions have a lot to offer in terms of enhancing human function. But how many people people come to you for this, but the average chiropractor in Guelph doesn't have people coming in their door saying, I want to function better.
God, I wish they did though.
I know. Wouldn't that be great? But they don't.
You remember school?
Yeah.
Remember school? We sat there for 4 years, right? Listening to, what were we told we do?
Yeah. Well, we improve function or whatever, but
Actually, no, I remember it. I remember it. They would say that, but then really all of the outcome measures they cared about.
Sure.
Like think of our clinic year.
It's pain reduction.
They wanted a pain scale. The only thing functional is when they gave you those forms. You know, remember those, like for a motor vehicle accident, there's all these like disability forms or whatever.
Well, but then the function they're looking for is range of motion.
Again, which if you go back into the literature, and here's another thing that it drives me crazy online, man. People think that I'm just making loose contortionists, as if range of motion is a good outcome measure of anything.
It's not really.
It's not. It's not. And again,
it never has been.
Whoever's listening to this is going to be the people who know that we don't talk like this, but it's those other people who aren't going to listen.
Yeah. Well, they're not going to get an hour into this, probably. Yeah. They gave up an hour ago.
Yeah, for sure. But we got to go back to this game. We're all over the place, but I think we're coming up with some things that are useful. But let's go back to posture.
Oh no. Yeah. Okay.
Because it's one that really affects people, right? Yeah. This whole time, everyone's going to be, I've been like this. I've been like this. I've been like this. I've had my leg up. What I fucking haven't been doing is this.
Yeah. Nobody does that.
Yeah. Because it's like, let's just break this down. So if you do this, in order to hold yourself like this, do you have to activate muscles?
Mm-hmm.
Yes. If you activate the same muscles for a prolonged period of time, do you decrease oxygen flow to the muscle?
Yes.
Yes. Okay. Well, if you have a decreased amount of, like, those muscles will asphyxiate, right?
Mm-hmm.
Like, just like if you do a plank for more than, what was that? There was a study on that, was there not?
Yeah, the blood flow, it was, that was a long time ago.
It was like 3 minutes or something.
I forget what the number was, but the point of it was if you hold it long enough, you're going to reach a hypoxic level that's probably not productive anymore.
Which again, whether or not the hypoxic level is reached in postural muscles that you're training by holding like this or other, that's the problem, is that the muscle can only give you so much anyway. So sitting like this is just as bad as sitting like this.
Yeah. And everybody's capacity is different there.
Yeah. Okay, so getting back to the other question I was going to ask though is, what does the research in general say about our ability to change posture using strength training exercises?
It depends. Where would I start? First, you have to take into consideration how you measure posture, because part of the challenge in studying posture is if you do a study, for example, where you take people and measure their posture, and then you put them in program A or program B with the patient knowing your posture is going to be measured at some later date. It's kind of like, it's not exactly like, but it's kind of like practitioners who take posture-based x-rays. You can change how an x-ray looks from a posture perspective just by cueing the patient in a different way, right?
100%.
So when you're doing
1 degree on the positioning is what on the x-ray, 3 degrees?
Something like that. And then never mind the error, but digital x-rays have not completely fixed the error problem, but the error is not as big as it used to be. But when you measure posture sequentially and the patient that you're dealing with knows you're measuring posture, they may change their test position, if that makes sense.
Mm-hmm.
And I don't think we have a good answer on whether exercise can change posture.
Okay.
Do you think we have a good answer?
No, I don't. I don't think we have a good answer, but I do think that if we start from that point and then try to come up with an answer using what we do know, I think that it's very easy to conclude that it's not as easy as you think.
Yeah, that's a good way.
And the example that I use at seminars is, a 12-year-old dancer. A 12-year-old dancer walks around like, they just have this ideal posture.
Mm-hmm.
Now, the ideal posture problem, I always ask people, when you were birthed, did you come with a manual? Because I didn't have a fucking manual. I don't think so. I've asked my mom, nothing. So I don't know that I know how to stand, but let's just ideal posture. When you're in a thing like dance, you're literally scored on this preconceived notion. So they have this posture like this, right?
Yeah.
But then you get like a rock climber. Let's say Dewey, you know Dewey, one of my main instructors, one of my good friends, Dewey. So Dewey, does rock climbing, right? So his whole life is retract, pull, pull. Like that's, to some extent, that's what you do, right?
Yep.
To tell me, and then if you ever watch Dewey stand, just like everyone else, you know what I mean? Like whatever, just normal. So the idea that somehow the 12-year-old dancer has stronger rhomboids than Dewey.
No, that's wrong.
That's wrong, right? So so now I can't make 100%.
Well, I mean, it might not be wrong, but it's, as a broad brush statement, it's wrong.
I mean, I deal with professional bodybuilders that have their posture is hunched, their back muscles are stronger than that 12-year-old dancer by any
stronger. Yes. Yeah.
If we just put it in the force velocity curve and just leave it at that, they're going to be stronger in every possible way. And, the same thing, like when you work out your biceps for years, you don't walk around like this.
No.
You know what I mean? And then you can say, well, some bodybuilders, they're stiff, but some non-bodybuilders are stiff.
Yeah.
So
it's this idea, like if you have like forward head posture, you need to somehow strengthen your rhomboids to hold you in a certain way. That's always bothered me.
By the way, now someone's going to be like, we're those stupid, because you also have to stretch the front.
Well, yeah, okay,
sure. So here's another question. What does the literature say about stretching and changing the length of muscles?
Not much. It's not very successful, partly because the input variables in the studies that are out there are largely different, and our ability to measure anything like that is not perfect, but in general, there's not a good answer there either. And the answer is probably no.
You know what I mean? Your gracilis is as long as it needs to be to do the splits, technically.
Well, and it's just that your brain isn't going to let it do that. It's back to the brain and the meat. It all comes down to how your brain interprets and uses the meat and the feedback that the meat is giving to the brain. We just simplified your whole system into that concept. No, it's kind of
like I do it all the time.
Well, I know,
it's meat and it's not, that's it. It's nervous system and meat. I mean, that's
right. So
back to posture.
Oh God, you love posture.
I love posture. So get back to the idea, how dynamic systems theory, which is if you're in fourth year motor learning class at a university, that's where you are. Okay, so the idea that to control a dynamic external system, let's call it your global workspace, that you need a static posture based on the dynamic systems theory as to how movements are created and learned. It literally, to believe that there is the right way to stand, in my opinion, is to completely disregard the newest evidence on human movement. Because never mind just on human movement. If you look at physics, chaos theory, everyone's going towards this concept that you're an adaptable environment working in an adaptable environment, right? Yes. You're a non-linear entity. There has to be adaptation strategies that are put in place, but you don't control those strategies. You can control your meat and how your meat speaks to your nervous system. The other thing go ahead.
If you expand this idea that there's a perfect way to stand, then there should also be a perfect way to throw. Yes?
Which we do not find.
Correct. Because if that were the case, every pitcher in MLB would throw the same way, but they don't.
100% not.
The same way there's no perfect way to hit a baseball, there's no perfect way to dunk a basketball, there's no perfect way to... So, yeah, to me, the posture is like the lowest hanging fruit on that argument. Like if there was a perfect way to do anything, everyone would do everything the same, and that's not how humans work. And yet, there are 200 people who have reached the level of being able to throw professionally and make millions of dollars, and they all do it differently. Don't they? Do any two pitchers pitch the exact same way?
we're going back to Bernstein in 1967, which is amazing because this is not like it's new. You know what I mean? Like,
yeah. And then that ties into this like movement assessment stuff. Like when we were in school, Kibler stuff was coming out about sick scapula syndrome. And if the scapula moves this way, it's bad. And they're not, and yet, like if you measure professional pitchers, some of them have a sick scapula syndrome. But if a guy's throwing 95 miles an hour, I'm not going to try and change his scapula. Am I?
I have all my pro pitchers, the pro team, that you find that all the time, which is like, and by the way,
maybe that's the adaptation that allowed them to do that.
Getting back to posture, the idea that you can train someone and then do static measurements of scapular position.
With this, like the base argument of this is static measurement of anything doesn't mean shit to how we move. It doesn't.
There's no logical conclusion other than that, which is another thing that I keep running into. But this is fun. Can we talk about another thing?
No.
The concept of imbalances, because okay, so now manual therapy. So there's I would say that the large majority of manual therapy is dedicated towards finding this thing called imbalances.
Mm-hmm.
I don't know if there's a question in what I'm going to say or if it's more of like a statement, but we've talked about this before. If you take a client and you look at the client and you say, you know, show me what you do with your right hip. Like, show me how you move your right hip, right? Show me how you move it. I would use cars, but just generally, show me what you can do.
Sure.
If you make a conclusion that, or if you ask the client, based on how you move, what percentage of your right hip do you feel you have versus your left? Or you can ask them, if you can imagine a perfect hip, where do you think you are with your right hip? Like, let's just say that. So if somebody moves their hip and they go, well, with my right hip, I'm probably like 60% of that ideal concept. And with my left hip, oh my God, it hurts. I can't move it. It looks like I have 20%. So if you have one side that has 60% function and one side that has 20% function, and this is just subjective. So of course it's going to be, they're not accurate, but it's going to be accurate to an extent.
Sure.
Right? Isn't every exercise you perform then just consistently keeping the imbalance present?
Potentially, yeah. It depends on, so let's take that scenario and put it in someone who's exercising, doing whatever 4 or 5 times a week. I think the answer to your concept there is yes, it is. It's just grooving that same pattern depending on what type of exercise they're doing. But if you take someone with asymmetry in their hip, whether it's joint play or motion or their ability to use it or however you want to frame that, and they're not doing any exercise, that's a different scenario. But they have to be exercising for that to matter. I get that, but symmetry is a hard thing to achieve, isn't it?
I don't even know. Like, I mean, last time I looked, I only have one liver.
Yeah.
You know what I mean? So I don't know how to fix that for you. Like,
luckily, I have 2.
I don't know how to balance that for you. I don't know. But the other thing is that this brings up a whole nother can of worms, which I'm starting to speak of more recently with strength and conditioning is, if that client has 70% on one side and 30% on another, those are both internal variables. But all strength and conditioning, and I'm not being an asshole here, I'm saying the vast majority of any strength and conditioning I've ever run into really only concern themselves with external variables. And I'll give you an example. As soon as you put someone under a squat bar, there's going to be 37 million personal trainers that have an opinion.
That's true.
As to what it looked like. But there's going to be very few of them that stop and say, yeah, but you brought a different body to the bar. Because we're evaluating what a squat is supposed to look like.
Sure.
But a squat is an invention, just like the word is an invention.
Right.
Of human consciousness, which goes back to what we were saying before.
Yeah.
So if human consciousness tells you, I want you to squat, then what you're saying is, I want you to replicate what I want you to replicate.
Yes.
Which is an external variable.
You're essentially making it a movement screen based on your preconceived notion of what it should look like.
And we've just been talking for the last half hour as there is no preconceived notion as to what it should look like, because
in theory, no. Like, you know, Um,
There's
every time,
safety, of course.
every time I say in theory, Siri thinks I'm asking her for something. That's just technology.
Can I ask you a question? Did you change her accent?
No. Did you?
Yeah, why is the question. That's
Why haven't I changed it, or why did you change it?
equally as strange.
What accent did you pick?
Australian.
Ooh.
Yeah. Huh? Yeah. Hey man, I'm locked in my damn house.
I know, right? Yeah, we're all going a bit batshit here.
Siri's my best friend at this point. Where were we, Shawn? Where were we?
Somewhere between posture and leopards. Forget.
Yeah, I don't even remember where we are. Let's just do a few more and then I'll let you go.
All right, man.
I'm going to say 2 words and then I want you to vomit whatever comes to your brain.
Is this like a Rorschach test?
Yes.
Okay.
Ready?
Yes.
Neutral spine.
Not terribly relevant to most people. Most of the time.
Glute inhibition.
We don't understand it, what it is or why it matters or if it's even a thing.
The glute.
Oh, big, strong, important. Yeah. Like the meat or the, no, I'm kidding.
Yeah. Let's not get into that. The neutral spine thing, I get a lot of that as well. I got a lot. So it's a topic worth just touching on. So when I teach someone how to lift, it's not like I don't teach them what some resemblance of neutral is.
Yeah.
I don't put them out of posture and say, fuck your back up. Clearly, there's a way to, if you want to replicate your exercise, which is a deadlift, not mine, but you know what I'm saying? Like if that's what you want to do, there's a way to do it such that you don't, cause injury just by doing it. Or there's a way to do it so that you can minimize the amount of injury you'll get just by doing it.
I think minimizing is the better term there. Yeah.
Because deadlifting is going to cause damage. Like I'm tired of not saying these words. Like squatting with a bar on your spine, it's not like it has no penalty. So let's all stop pretending like it's okay and everyone should be doing it at all times.
Yeah. I'm with you.
Okay. So you're with me, but I forgot where I was.
Deadlift. Neutral spine.
I'm going to teach someone neutral, but I also understand, and maybe I misinterpreted the research, that even professional lifters can't maintain neutral.
Not always. I mean, there's neutral spine's this thing that it's sort of the concept threw people into this little box where that's all they cared about for a long time. When human movement and specifically athletic performance can't possibly always occur in that area.
I would say it never does, to be honest, or almost never.
It probably doesn't. But I also think if someone, how should I say this? I think neutral spine training should only be part of your training. It shouldn't be all of it. And I think that little box that was created years ago put people in this idea that that's the only way you should train your spine. I don't think that's right. Does that make sense?
Yeah, and I mean, I guess we can go backwards as far as to the controversy in our day was this Australian or Queensland versus McGill.
Right.
And the whole time I was like, why are we arguing about this? Like, why? Like, one of them is clearly saying that the status of your inner meat is going to affect the status and function of your outer meat. Mm-hmm. And the other side is making it sound like the other side is just saying, all you need is your outer meat, which is to say inner meat has no value.
Yeah.
That's how
I think they were both allowed to be partially right. And, the paper that we reviewed last week was a summary of what we know about motor control and low back pain. And Paul Hodges from the Australian group was one of the authors. Greg Kotchuk from the chiropractic world was on that paper too. And, the punchline from that article is the motor control changes in low back pain populations are not consistent. Mm-hmm. So back to what we said earlier, like for some people, I always looked at it this way, and maybe I was wrong, but this held up clinically for me. If someone had back pain that had a motor control component, in my opinion, I would sort of see what they could do. Can you do a gentle brace and activate something in your abdominal cavity? And if you can, and I can perceive that to the best of my ability to be your transverse abdominis, let's say, then I would progress them into McGill stuff without worrying too much about, I looked at it as a continuum. I guess that's what I'm trying to say. Like the transverse abdominis basic core bracing stuff was like kindergarten. And then McGill stuff was a little bit further down the road, but I think everyone just stopped there instead of, and I don't think that was McGill's intent ever. He was just looking for, and I know Ed Cambridge is one of my friends and a recent PhD student that finished his PhD with McGill, but they're looking at ways to minimize adverse stress on lumbar spines. And in some ways, neutral spine, however you want to achieve that, is one of the methods to do that, right? But that doesn't cover, I think we all just assumed that the McGill Big Three covered everything you needed to cover in terms of human performance and athletics, and that's not right. I don't think that was their intent. I don't want to speak for them, but I don't think that was Stu's intent.
I don't think so either. And I speak to this, and I automatically say, if you guys think that I'm somehow insulting Dr. Stu,
no,
that shit crazy. Like, give your respect where it's due. However, I always say that the interpretation of what people are saying is where people screw up. And then with regards to the Big Three, like if I took a weight, let's call this pen a weight, and I did this, and this is what the exercise was. Would anybody claim that this is an elbow exercise?
Maybe.
Okay, so I mean, you can say that the elbow has to hold, I can give you a, kinetic chain. Yeah, sure.
Yeah.
You would probably say that this, okay, name this exercise.
Shoulder. Lateral raise. Yeah.
Shoulder exercise, right? So no one would say, oh man, that's an amazing elbow exercise.
Yeah.
However, the number one spinal exercise in the history of rehabilitation and spinal training is to go on all fours and try to not move your spine. As flex your shoulder and extend your hip. I'm not saying it's not a good exercise, but what I am saying is if you think that that is all you need to do to make a spine healthy, you're probably doing 7,000 exercises you don't need on other joints, and you're not giving each one the same.
Yeah, like you have to remember that those exercises were designed with the idea of maximizing muscle activity and minimizing compressive load. That was pretty much the variables they were dealing with there. And those exercises definitely do that. But as I said, I think that gets us to a point. Like, does the average NHL hockey player have to do a cross crawl or a bird dog? Probably not, right? Unless they're hurt.
Yeah, like what do you, I mean,
I don't know. Just saying. It's not that it's not a use, like there are no useless exercises. I shouldn't say that, there probably are, but there are exercises that are given to people who shouldn't be doing them, but there are also people who should be doing much more that aren't.
So again, it's this, is it internal variables you're concerned about? Is it external variables are you concerned about? There's a neutral spine thing where don't move, hinge at your hips, always be in neutral spine. Every exercise is in neutral spine. Walk in neutral spine. Sit in neutral spine. Pick things up in neutral spine.
Yeah, and if you leave neutral spine, bad things will happen to you. If all you did was train in neutral spine all the time, bad things are, I would argue, probably more likely to happen to you if you leave neutral spine because you're not ready for that or you're not adapted to that.
Specificity. That's not even an argument. I don't think. I think you're 100%, right, and nobody can tell you you're wrong. And the other thing you have to answer with for me is, how do you maintain the health of a human articulation? What's the movement? So if you're telling someone don't move, are we not trading acute low back pain for chronic dysfunction?
Well, I think one of the unintended consequences of the stabilization phase in low back pain treatment was that it scared the shit out of people about moving around.
Yes, 100%.
And then wouldn't the pain neuroscience people jump all over that and say that's a nocebo effect and that's horrible and whatever? But yeah, I think that wasn't the intent of the researchers that were doing it, but I think that was one of the results of it is people got scared to move their backs.
100% agree. I know we probably should end this eventually. We can do this indefinitely, but I got to pull you in for one more.
Okay. I was going to say your assistant sent me the calendar notice and it went till 11 p.m. tonight. So
oh yeah. So you just
all day
cleared the schedule.
Just cleared my day.
Well, after this, I got to,
Yeah, I was wondering if we were going to bring Calvin and Adriano in for a bit of this.
Have you heard the my kids upstairs? Like it sounds like
No,
yeah, they're elephants upstairs. Like it's
I think Katie may have taken our boys way upstairs. So I don't know.
oh, really? Well, I got three going on. Yours are little, and you can put them in an area, concealed area. But
Sort of.
and mine climb out, and they're on this fucking ceiling and shit. So
Yeah.
okay, the last one I want to get at, because this one touches to what I say a lot. And if you're ever accused of being a shitty peddler, this is where I get it with
Okay.
with soft tissue.
Okay.
So, okay.
I will do my best to confirm your biases. Go on.
Thank you. I appreciate that. Is there enough, in your opinion,
Mhm.
to disregard the utilization of therapeutic touch?
Like as in we shouldn't touch people and
Let's just start from very, very broadly. Should we at this point conclude that human touch has no effect on another person that you're touching?
no, it should be the exact opposite.
Okay, so I want to get there. Okay, so
Okay.
touch.
Sorry, I didn't mean to.
No. So touch has relevance.
We're just rewarding the people that have lasted this long.
Yeah, seriously. Touch has relevance scientifically.
Of
Okay.
course.
Is there enough, based on what we know right now, is there enough research to say that soft tissue therapy should stop now, and we're just going down a rabbit hole which ultimately will lead us to nowhere, and there's no relevance of it at all anymore?
No, that's incorrect. Mainly because it's never been studied well at all.
Okay.
So the absence of evidence is not evidence of absence. So no, that's premature.
It's immature scientifically. It's immature in every way, because if you go back to Einstein, the theory of relativity came from thought experiments. So if you can answer me this question: does thought precede research?
Yes.
Is that 100% true, Dr. Thistle?
Most of the time, like nothing's 100% true, but you have to think about something before you can put it into a scientific model.
Okay,
like
so
science is a model of thinking, right?
yeah, agreed.
Just like a religion is a model of thinking. Science is kind of like a religion, just with more publications.
I would agree with that as well. So with regards to soft tissue work, how do you approach doing versus non-doing? Because there is a subset of there are internet scientists out there who are influencing young therapists into believing that all you need to do is tell people they're going to be fine, and kind of pat them on the head, and don't do things that hurt, take it easy.
So this issue is tough because I tend to default to the right patient, giving the right patient the right intervention at the right time. The trouble is they don't come in with an instruction manual, just like kids aren't born with one. I think the exact nature and type of soft tissue therapy in a lot of patients is not as important as the fact that someone is paying attention to them and trying to palpate them properly and locate areas that are sensitive. And the flip side of it is, what is the soft tissue work actually doing? I don't think we have a good answer to that, but I don't think we can throw everything away just because we don't have that answer. Because if it wasn't helpful for people, people would have stopped doing it long before you and I got to school, wouldn't they?
I don't know. You go back to religion, because
this is maybe
that's the problem. But my thing with that is that there's nothing unscientific of what you just said. There's nothing.
Thanks.
Yeah, there's nothing that I would disagree. And now we have to move forward from this point. So to move forward from this point, it goes back to the meat argument, in my opinion. Is like the meat is influenced by force. Can we agree?
Yes.
Okay. There's types of force. There's internally derived force, and then there's externally inputted force.
Yep.
I think we're both clear that internally derived force can change the ongoing structure of soft tissue.
Yes.
Because I mean, if I do this long enough, there's more of this. Like, okay, so the question then becomes is whether or not the force application externally makes the difference.
Yeah.
Right? And I've never said it did make the difference. I've always said it's just one type of force loading that kind of specifically puts force in one area versus
Sure.
just doing this, the force dissipates.
Sure. And you know, neither of those ideas has been adequately studied individually, never mind putting it together.
I totally agree. So
we don't know. Like,
so my conclusion is I'm always going to give internal forces to back up external forces.
Mm-hmm.
External forces, even if you go back to the therapeutic effects of touch, just from a psychological perspective, I think I'm justified as long as I'm not getting them addicted to the treatment, which I think everyone can agree. I'm not trying to make you want me to rub you. Right?
Yeah, but you know, the propensity of someone to become addicted to it is an individual factor, but it's also governed by how the clinician presents it and does it and whatever.
100%.
But
what I'm saying is we can agree. I think we agree with where everyone else finds problems. I can say that I agree with the same problems. Like,
sure,
training is what changes you.
None of this is perfect. Like using patient education and pain neuroscience as a single intervention is probably no better than using spinal manipulation as a single intervention. It'll have a moderate effect on a moderate amount of people.
Mm-hmm.
Okay, here's if we want to make this relevant to this COVID situation, you and I are sitting in our houses because we were going to do this in person, but we can't right now. Everyone is suddenly an expert on telehealth. Have you seen this? Virtual appointments.
Oh, wow. Yeah. I've noticed this.
And you and I don't rely on practice for what we do anymore. So I understand why people are doing this. But what's going to come from this is there's going to be a bit of evidence emerging about how effective doing a treatment is, like you and I are doing this conversation right now.
Brilliant. Yep.
What if telehealth appointments, and there is some evidence already, there was a paper I just saw on Twitter this morning that looked at the diagnostic accuracy of a patient doing a self-examination for femoral acetabular impingement, a battery of tests that they could do to themselves versus a clinician doing that examination for them. And the diagnostic accuracy was the same. Mm-hmm. What if telehealth, to your point of like, do we have to touch people? What if it's equivalent? What if you can take a spine pain patient, do an appointment like this without manipulating their back, without touching, soft tissuing their hips or their erectors or whatever, and the efficacy is the same? What does that mean for our professions?
Okay.
That's a tough one.
It's a tough one, but
because this is going to necessitate us learning about this.
What's the outcome measure, though?
Well, I guess it's the same old outcome measure. Do you feel better? And then usually that defaults to pain.
Again, then it defaults back to what is our job? Because this is the point, right? Okay, sure. Let's say that you're correct, and to be honest with you,
I don't know. I don't.
And we're also comparing that to the level of soft tissue that was being done prior to this happening.
Right.
We agree the outcome measures were wrong. The literature, the research is on soft tissue is kind of bizarre. Like, whenever you say I do soft tissue, someone goes, there's research to show that you can't break fascia because you can't put enough force into fascia to break it. And I was like, I don't want to break fascia. Whoever said I wanted to break fascia? Like,
sure.
So I would argue,
the problem with soft
tissue of soft tissue work was never even studied, because when I say to someone, find pronator teres, they've been in practice for 30 years. You can't even show me where it is. Like, I don't know that we've ever studied soft tissue therapy to the extent that it needs to be studied.
No, we haven't at all. We just started assuming what the mechanism was without studying it.
Yeah.
It's the same as spinal manipulation. I just did a talk at Parker in Vegas in February about the mechanisms of action of spinal manipulation. We still don't have a final answer to that.
Mm-hmm. Mm-hmm. But evidence from an evidence-guided standpoint, you would not disregard the use of spinal manipulative therapy.
No, we're not talking about efficacy. We're talking about mechanisms. Those are two different conversations.
Of course they are. That's what, exactly, right? That's
right.
Anyway, listen, man, we're going to do this again for sure because number one, we have nothing else to do.
No, we should do it again tomorrow.
Do it again tomorrow.
I'll put on my Thursday sweatsuit for you.
And number two, I have, there's just a lot of questions. I mean, we could have just done the whole thing on back pain, right? Because there's just so much more to talk. But I think that we've at least set up the umbrella of what kinds of things we're going to talk about. So whenever we're on a podcast together.
Yeah, we could do like open it up to some pre-screened questions.
Me and the community? I would love
to.
Why not?
Why not?
Let's see what we get in from this way. But anyway, you website is?
RRSeducation.com.
RRSeducation.com. At the moment, I don't know what's going on because, you know, businesses are at a standstill, but in your case, there's I don't know how many reviews have you done? Like, do you even have a number?
We're over 950 now.
So when everybody asks me, like, how do you keep up to date with the research aside from reading? I mean, when someone's going to summarize a lot of stuff for you and just give you the stuff to read that's important, I would recommend it. So that's one of the ways that I do it for the people who are listening. But anyway, that's it. Give hugs to your family, man. Anything else to talk about before we wrap it up?
No, I don't think so. We touched a lot of space there, didn't we?
I think we as much as we can do for one sitting. So
yeah, for sure. All right. Well, thanks for having me. Keep up the good work, brother.
Thank you, sir. Talk to you soon, man.
You bet.